Welcome, everyone. Thank you for joining us for today's City Program webinar. Today's topic is FMLA Essentials, Guidance for Employers in Grant-Funded Research Settings, and will be presented by Tanya Brown. Now, let me tell you about today's presenter. Tanya Brown is the Senior Director, HR Consulting, Employee and Labor Relations at Vanderbilt University. She has 15 years of experience in human resources in many industries, including the private sector, public sector, and higher education. Tanya currently leads a team of HR consultants who are the primary contact for leaders and employees across the university for matters related to human resources and workers' compensation and leave. Tanya has a Bachelor of Arts in Social Sciences with a minor in Psychology from the University of Arizona and a Master of Science in Human Resources Strategic Management from Bellevue University.
For our time today, we're going to spend time learning about the Family Medical Leave Act, and we're going to cover the overview of the FMLA regulations, review the process for administering FMLA, understand the leave entitlements afforded by the FMLA, and then review the considerations for administering FMLA in a research setting. So the FMLA itself was enacted in 1993, not that long ago, and it provides employment and benefit protections to employees that need to take leave to either care for themselves or a family member's serious health condition. Later on, after the law was enacted, there was an amendment to the act that actually increased the leave to care for military family members that have a serious health condition. So now let's talk a little bit about those benefit protections. So we talked about we get a 12-week job protection during that time frame. We also now have 12 weeks worth of benefit protections. So again, they maintain the same benefit protections as when they're active. So their level of coverage, the price of coverage, all of the plans, all of that stays the same. They're also eligible for any changes. So if you're going through your annual enrollment during the time that somebody is on leave, they need to be allowed to go in there and make those changes to those coverages so that they have the same things as everybody else. And like I said earlier, employees are required to pay their portion of the benefit premiums while they're on leave. If they do not pay, they can be dropped from coverage, but again, you had to notify them of that in those notices from earlier.
And I invite you to review our content offerings regularly as we are continually adding new courses and webinars in various areas of research, ethics, compliance, and professional development.